knock, provide privacy. Hi, my name is Caitlin. I'll be your student nurse today. Can you verify your name and your birthday?
Joseph Smith, 10/5/54.
Excellent, thank you. Just gonna check that with your band. Awesome. All right, Joe. So the provider had ordered some wound care, so I'm going to take a peek at your dressing, look at your wound, and then apply new dressing. Okay.
Okay.
All right. Any allergies that I should be aware of?
Sulfa.
Sulfa. Okay. Thank you. And then just going to note that right now I'm not going to put any gloves on, but then when I come in contact with bodily fluids, I will have some on. All right, so I have my equipment here gathered, ready to go. Just gonna confirm the sterility of the packaging, that I have the correct solution of what I need, and that the expiration date's good. Just confirming sterility, and then the expiration. Confirming sterility, expiration. Great. My gloves, confirming sterility and expiration of them as well. All right. And then are you comfortable where you're at, Joe?
Yes.
Are you in any pain today?
No.
No pain? Okay. So even though Joe's not in pain, I would still go through and do the old course mnemonic. So we have onset, location, duration, character, any aggravating or alleviating factors. We have R for radiation. T would be maybe specific types of treatment or the timing of the pain. R could be radiating or also relieving factors as well. Went through T. S would be severity then. And then Joe noted no pain, so good there. All right, Joe, if you're comfortable and I have all my equipment, I'm just gonna do my hand hygiene. And then go from there. And then while I do my hand hygiene, I'm just gonna note that Joe would be pre-medicated 30 minutes prior, and then also gonna just go through the 9 sterile field principles while I'm drying my hands before applying gloves. All right, so we have the skin is not sterile. There's a 1-inch border. Only sterile can 1-inch border. Only sterile can touch sterile. Anything below the waist is not considered sterile. Only sterile water can go in the sterile bowl. Sterile water moves in the direction of gravity. It's important to be honest, to never turn your back to a sterile field, to limit time that the sterile field is open. And then the skin is not considered sterile as well. So I've got that, and then I will just apply some gloves and take off his dressing. And I'm just gonna make sure that the waist basket is here. I'm gonna move you up to my waist, okay, Joe? So I'm not bending over you.
All right.
Anything below the waist not considered sterile. All right. So I'm gonna expose you a bit here, okay? All right. So just gonna take off the bandaging here. All right, so I'm just going to note that we have a surgical wound here in the right lower quadrant. I don't see any exudate or type of drainage on the packaging here, so I'm just going to put that nicely in the garbage. I'm just going to note the different types of fluid then. So there's the serous fluid, which is thin, yellow, clear, watery like. There's also sanguineous fluid, which is a bright red, indicates fresh bleeding. We have the serosanguineous fluid, which is a combination of the serous fluid and sanguineous fluid. And then we also have purulent drainage, which can be like a green or yellow, thick, can indicate any signs of infection. It can be odor, or it can have a distinctive odor as well. So also while assessing the wound, going to also note if there is any sort of infection too. So I would look for any like if Joe would have a fever, if the site is red or warm around the area, any change of consciousness, so redness, warmth, swelling, the type of drainage of like purulent drainage would be present then. All right, Joe, so since I've got you exposed and your dressing is off, I'm gonna go ahead and set up my sterile field here then, okay?
Okay.
Okay. Just gonna hand hygiene again because why not? All right, I'm gonna move that off to the side here. Okay, so I got Joe on the table at waist level, and I'm gonna open this away from me. Going to remember the 1-inch border is not sterile here. I'm gonna grab the corner. Okay. Still doing okay, Joe? You're comfortable?
Yep.
I'm just gonna step back while opening these here. I'm gonna just grab the edge. And I can put this here. Remembering sterile can touch sterile, and that 1-inch border. Got stuck to my hand. Okay. I'm gonna just step back. Just drop it on there. Get off. Go. Ooh, close to that 1-inch border, but we're still good. We're still within. I'm gonna step back and open. That one was really stuck on there. Okay. Step back and open away from me. Well, alright, remembering. Forward. You have them on there. There we go. Alright, and then I can go ahead and do the sterile water here. I'm gonna open up and away. I'm gonna keep it 4 to 6 inches above the bowl, and just remember that water cannot splash out. 4 to 6 inches. No water can splash out. Good. And then for the sake of this, I'm gonna recap it and put it on the table behind me since we reused them. So there's that. All right, so all is set up. I can apply my sterile gloves then. So I can move things around. Keep that away from me. So that flap did not come out, but we're gonna open it. There we go. And then I can take, just gonna put some sanitizer on before putting them on. Alright, I'm gonna take my non-dominant hand. Grab the cup and throw them on somehow. Sure, worry about fixing that finger later. Then I can take my fingers, go underneath the cuff, and put this on. And then since sterile can touch sterile, I can adjust my finger here since we're kind of stuck. And then I can pull the cup up. Okay. And then then this is when I have my gloves on. I can start maneuvering my Stereofield around how I need it. Above waist. Still doing okay, Joe?
Yep.
Awesome. Reach for my ABD pad here. Get a little bit closer. All right, Joe, I'm going to start cleansing your wound then, okay?
Okay.
Okay. So I can sacrifice this hand here to grab onto the incision or the surgical wound here. There we go. Gonna just grab my sterile gauze, make sure no fluid drips out. All right, so we're gonna go around one and drop it. Go one. And I can go the opposite way and drop it in. And then grab my last one, get the little drips off it. Good. Oh, and I got a little bit on my towel. And go the opposite way. Drop it with my tweezers. And grab my splits here. And then Pac-Man them. And just nicely put them on without touching anything. Gonna grab my other one nicely. Put it on without touching anything. The opposite direction. Good, and then I can grab my gauze here. I can put the tubing down, put my gauze over top. I can grab my ABD pad, put this over top. Okay, and now the sterile is done. I'm gonna tape it down, so I'm gonna hold that there. I'm gonna tape it down the corners. All right, still doing okay, Joe?
Yep.
Awesome. Let me get my last piece of tape here. Taping the corners. Gonna do the date, the time, and my initials. And I'm gonna get Joe nice and comfortable. All right, Joe, is there anything else I can do for you while I'm here? I have time?
Nope.
Okay, I'm gonna just lower him down so he's not hanging out at my waist. All right, so I'm gonna make sure that the bed is low and locked. Side rail is up. The side rail will be up here. And then call light within reach. His table would be near. I'm gonna make sure his room is risk-free of any falls. So I can clean up all my yuckies here. Put them in the garbage. Good. Put this back. This would go in the garbage. I'm just gonna leave it there, and I can take my sterile gloves off. Do my hand hygiene. So the 5 moments of hand hygiene: before touching a patient, after touching a patient, after touching patient surroundings, before procedure, and if there was any contact to bodily fluid. I would document any abnormal findings per agency policy, and also do my own documentation of OneNote and upload that into Schoology.